Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
There are 11 main systems within the human body. This includes things like the circulatory system or the cardiovascular system, the digestive system. We have the immune system. We have our integumentary system. We have our muscular system, the endocrine system, as well as the nervous system, reproductive system, renal system, skeletal system, which includes our bones, as well as the respiratory system. And today I want to focus on the respiratory system in particular because we are in the midst of a pandemic. And for a lot of people, they know that with COVID-19 that this is respiratory borne. So we have to pay attention to the care that we are actually taking of our respiratory system during this time. And I want to focus in on some science behind different nutrients and why these nutrients happen to be so beneficial when it comes to our respiratory system. So I am Amanda Williams, MD, MPH, and I want to talk about the respiratory system in some general terms, but also when it comes to specific nutrients. We know that the respiratory system itself is basically, it's a network of different organs and tissues that help us breathe. So when we think about our lungs, clearly that is part of the respiratory system, but also the airways, the blood vessels, muscles that are all interconnected and work synergistically together to make sure that we can move oxygen throughout the body. So remember, when we breathe air in, we have to go through kind of this filtration system in through the lungs, but we also have to be able to allow for oxygenation to make its way out to the tissues. And when we look at the long-term implications of COVID-19, and the major thing that most people focus in on is the respiratory implications and having that acute respiratory distress syndrome, which is what generally leads people to have to go on to ventilators. And we know that about 40% of COVID-19 patients will develop acute respiratory distress syndrome. And of that, about 20% of those cases fall into that severe category. And it's that severe category where, may require oxygenation or even to the steps of mechanical ventilation to maintain the ability of the respiratory system to do what we need it to do. So when we see these different patterns with COVID-19, we also have to be aware of the fact of the long-term implications, even for someone who has maybe a mild case of COVID-19 or someone who, hopefully you don't have any type of an exposure to COVID-19, but we want to make sure that we are doing everything in our power to make sure that the respiratory system itself is, functioning at its peak performance, and making sure that we don't have an excessive amount of an inflammatory response going on and doing damage. And now one of the areas that they're starting to recognize now that there's been enough COVID cases throughout the world is the development of fibrosis and pulmonary fibrosis in particular. So when we look at idiopathic pulmonary fibrosis, they know that this is brought on due to, variety of potential causes, and the COVID-19 viral infection happens to fall into that. And what we see happens is that we have this cytokine storm that occurs, and this is caused by an abnormal immune response, and we get this overabundance of all of these different inflammatory cytokines that spread throughout the body. But what they are recognizing is that this is actually creating a potential damage within the lung itself. And so if we end up with any type of pulmonary fibrosis, then this can be a long-term effect which is going to impact really lung function moving forward. Now, there's other things that we know. We also know that there are many different nutrients out there that have shown that they can be very targeted when it comes to pulmonary fibrosis. There was a study that was published in the Pulmonary Medicine Journal just in May of this year, looking at pulmonary fibrosis and that COVID-19 link. And they were looking at the different evidence showing the overall risk factors in terms of development of lung fibrosis in the disease itself. And this is something that I think people need to be cognizant of, because you've probably at this point in time heard of COVID long haulers, people who are still exhibiting symptoms even if they're after having maybe a mild case of COVID-19. Well, one of the areas that they're starting to really hone in on is the level or the extreme amount of damage that may have been caused within the respiratory system. Now, in looking at that, we can see that the respiratory system is not just defined as just the lungs themselves. So we have the airways, we have the blood vessels, we have the musculature. So all of these areas that could potentially be impacted due to COVID-19 exposure and have a real problematic effect moving forward, which is why so much of the kind of scientific studies are starting to lean towards that way is, what can we do if someone has developed any type of persistent damage due to COVID-19 infection, with connective tissue disorders and looking at, maybe being more prone to future respiratory infections. So all of these things are things that we certainly can't just turn a blind eye to. We have to be aware of the fact that, COVID-19 development of acute respiratory distress syndrome can certainly become a major health concern for someone moving forward. So what are we to do about this? So we know that there's a lot of research out there looking at idiopathic pulmonary fibrosis, and this is this progressive, lung disease. We know that there are certain nutrients, NAC in particular, that have been looked at as being a potential treatment actually in the setting of pulmonary fibrosis. And in the Experimental and Therapeutic Medicine Journal, back in 2019, they were looking at NAC specifically, and NAC has this powerful antioxidant capacity to it. Now, oftentimes we recognize NAC for liver health, for example, and this is the common mainstay treatment if someone ends up with, say, acetaminophen toxicity and is going into liver failure and they end up in the emergency department in that type of a presentation. But we also recognize that NAC does a lot when it comes to the respiratory system. So for the support of the vascular system, within the respiratory system, as well as for the lungs themselves, which is why for many people who have a history of respiratory airway disease, whether that's COPD, emphysema, looking at pulmonary fibrosis, NAC oftentimes will be prescribed by their pulmonologist. So I think that that's just a point worth notating about, because NAC is a very, very powerful way for you to support your respiratory system. So when we look at ways to be proactive as opposed to being reactive, NAC is one of those proactive means. So for someone who luckily, has not had exposure to COVID-19, but still has concerns and wants to make sure that you're doing what you can to maintain overall respiratory health, NAC is a really important nutrient to consider having on board. We know that NAC plays an integral role in terms of inhibiting the expression of those pro-inflammatory cytokines. Now, what do we know about pulmonary fibrosis? We know it's that overabundance of that cytokine release that does that extensive damage that becomes, in a sense, irreversible. And this is why we look at NAC and go, okay, wait, if NAC can actually inhibit the expression of those pro-inflammatory cytokines, then we should probably be including this into any type of a routine. And this would make a lot of sense, being that NAC has been studied in the setting of different bacterial infections, as well as just, say, influenza, for example. We know that one of the ways in which NAC has this capacity to do this is it helps to suppress the master signaling molecule known as NF-kappa beta. So if we can downregulate NF-kappa beta, we can stop that incredible flood of those inflammatory mediators going out and doing that significant damage. So there's a lot of ways in which NAC has been shown to be quite beneficial in this type of a environment. We also know that NAC has a protective role when it comes to tissues. And when we look at even exercise-induced oxidative stress, when you're working out, oftentimes we can release too much lactic acid, for example, which can do damage within the musculature. So we know that NAC has been shown to be able to combat that or offset that long-term damage, which is a very important thing when we look at the big picture of what the respiratory system actually encompasses. So we talk about the vascular component of the respiratory system. When we think about the musculature of the respiratory system, NAC really can have this powerful ability. In 2015, in the European Respiratory Journal, they were looking at the influence of N-acetylcysteine on chronic bronchitis and COPD. So this is an area for people who are aware of, long-term respiratory or chronic respiratory problems, that, hey, they're always looking for something. They don't always want to have to turn to that rescue inhaler. So the doctors and these researchers were saying, well, maybe if we include NAC, which we know is this precursor to helping the body enhance its manufacturing of a natural antioxidant, glutathione, and we know that this NAC can do these different things like downregulate that inflammatory response. And if we have excessive inflammation occurring within the airway, then maybe it would make sense to consider NAC. And that's exactly what they did in this study out of Europe. And they found that when they gave NAC in doses above 1,200 milligrams per day, that this helped to prevent exacerbation in patients who had chronic bronchitis, as well as those who had COPD. So I think that's a really cool study. We also know that N-acetylcysteine currently is being looked at in terms of COVID treatment. And there are a couple of active studies right now looking at the potential utilization of N-acetylcysteine when it comes to combating COVID-19. So in the Therapeutics and Clinical Risk Management journal, which was published just last month, they were talking about the use of NAC and if this could have any type of ability in a clinical setting to treat critically ill septic patients that have the diagnosis of COVID-19. And they go into some detail on the background of N-acetylcysteine, of it being an antioxidant, having the anti-inflammatory properties and these immune modulating characteristics, and that this could all together work synergistically to prove to be very beneficial in the treatment and prevention of COVID-19. So I think that, when we look at something just like NAC alone, we can say, okay, that's probably something I may want to include into my daily supplementation routine. Now, how much should you be using? That's a great question. And I would say in this time, because of the current state of this virus still circulating throughout the population, I would be looking at, taking one capsule twice a day at a minimum, which would be 1,200 milligrams, and you'd want to take that with food. So maybe take one with breakfast, one with dinner, for example, would be perhaps an ideal way. But I also want to talk about some other nutrients that we know definitely have really powerful respiratory support capabilities. And that would include quercetin. So we know that that is a bioflavonoid and it comes from foods and it is a very powerful antioxidant, but we certainly know that it is a potent nutrient when it comes to maintaining and supporting our respiratory system. We can also look at things like black cumin seed extract. So we have that really wonderful product. If you go to our website, invitehealth.com, and look at our black seed with rosemary and cordyceps. So it has cordyceps mushroom to help to support the immune system, along with rosemary extract, which helps with the regulation of histamine release, along with black seed. And black seed also goes by Nigella sativa or cumin extract, is a very powerful herbal way to target inflammation in the body. And we know that in the setting of acute respiratory distress syndrome that can be brought upon because of something such as COVID-19, that we have to address that inflammatory response. And one of the ways in which black seed extract has been studied for extensively is in the setting of allergies and asthma and targeting those pro-inflammatory factors. And the more that they have researched black seed extract in the setting of lung function, this is where it really started to gain momentum in terms of the natural industry as being a way to really target a overreactive inflammatory cytokine release. So these are all nutrients that are really good ideas to consider having on board during this time. So N-acetylcysteine, about 1,200 milligrams per day. Looking at quercetin, certainly quercetin we know is this power antioxidant that does so much when it comes to targeting detoxification, as well as when it comes to fending off oxidative stress that can occur within the respiratory system. So all of these different nutrients, along with even you can throw Inflamman into that mix as well. And the Inflamman is a blend of perilla extract, which has been studied in terms of supporting healthy lung and respiratory function, along with a very unique omega-3 fatty acid, which is the green lip mussel. Now, what's interesting about this particular product, the Inflamman, and with this combination of the perilla and the green lip mussel, is both of these have been studied specifically for respiratory function. They have found that diets that are rich in the omega-3s that are derived from the green lip mussel can actually help to fight asthma. And that particular study was done in the setting of asthmatic children, and they found that when they had higher exposure to these omega-3 fatty acids, that it reduced the inflammation within the respiratory bronchi, hence improving lung function. And that was from La Trobe University. Now, we also know that Indiana University looked specifically at what we use in our formulation, which is the New Zealand green lip mussel. And they were looking at utilization of the New Zealand green lip mussel, which is what you find in Inflamman. That's our product, the Inflamman. They found that this particular omega-3 was very effective at reducing asthma symptoms. So you see all of these ways in which you can support your overall respiratory health. We can take antioxidants such as NAC that go well beyond just fending off oxidative stress. They're actually working in the body to downregulate a inflammatory over response. We can look at the black cumin seed, which we know also is very targeted towards helping to support a healthy inflammatory response. We can look at the green lip mussel. We can look at the quercetin. So all of these different nutrients that, for me, when I am asked that question, is what should I be doing right now just as a proactive approach to respiratory health? Those are kind of my big ones that I turn to, is going to be NAC, black seed with rosemary and cordyceps mushrooms, the quercetin formulation, along with the Inflamman. So it's a really nice way to enhance the overall functionality within the respiratory airways and to support the lungs, to support the musculature and those blood vessels. Now, if you want more specifics as to how you should be taking any of these particular products that I mentioned today, definitely reach out to one of our healthcare experts at any of our locations, and they will be happy to assist you. That is what they are there to do, is to help you help yourself. And that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram, and we will see you next time for another episode of the Invite Health podcast.